articulated. But okay, so the 4-month update. So I'm 4 months out and I waited to do this video because I really needed to take care of my health, and it's really not often that you see people YouTubing their experience as they're going through the regenerative medicine. Usually people will heal and then share their story. So for me, I have to choose when to share because every day is so up and down. It's so difficult. And I experienced really severe dystonia. It started about 6 months after the my initial CCI incident, and it was due to for my atlas slipping out and then no one putting it back in, and then I had like additional trauma to my jaw from an atlas orthogonal. So they're very connected, and it was my jaw, and I truly believe that then the dystonia for me started from like trauma and then very chronic stress and then proprioception imbalances. You know, when you don't move your head for 2 years, your gravity, your ears are working just in one plane of gravity, and that really affects your proprioception. Your body quite literally doesn't know where it is in space. It's having a really difficult time. So I'm not gonna lie, the dystonia has been really, really severe the last 4 months. It's been very discouraging, and it's not because of the PICL. It's been just because dystonia gets worse when you're not moving your neck, when you're under chronic stress. You know, this is another reason why I wanted to bring up the complexity of healing. It's not like, you know, CCI is just like easy, let's solve it. There's so many secondary effects that are devastating, and some people just have dystonia, and then to have dystonia and like CCI, for example, these are very complex conditions on their own, and then to have them intertwined, it's very difficult to manage. It's really difficult to find teams or people that are even knowledgeable about these things, and it was really difficult for me. Okay, I'm gonna try to simplify this. I wrote some notes. The procedure itself went very well. So going into the procedure, I was very nervous because I had a lot of feedback from different physicians, even the physician that did my procedure, that I was a very severe case, and if this didn't go well, I would need a fusion. And that pressure, I think, can cause a different cycle of like negative thoughts and fear. And so I actually had delayed the procedure for a year because my intuition last year just told me that this procedure was not the right time. I knew I would need it, but it was not the right time. And looking back, that was the biggest blessing. Always listen to your intuition if you feel that that's the right step. It really helped me with the timing of the procedure. My PICL went very well. So one of the reasons it went well was because my doctor injected very conservatively. He doesn't often do that. I'm one of the very few patients he said he's had where he injects quite literally just the 3 injured structures. So my 2 alar ligaments and my transverse ligament are very injured. And usually as the needle is being pulled out, they'll inject multiple anterior ligaments, and then they will actually gently flip the patient over and then do the posterior neck. And for me, I would not have been able to tolerate that, partly because of the sensitivity of the nervous system reacting to the needle penetrating these structures. But also in the healing process, your ligaments typically become, I want to say, they have to become maybe looser before they tighten. It's just the way the collagen is being laid down, you can kind of get an increase in symptoms or a flare or a dip. And for me to have the whole neck and head kind of go through that looser or weaker stage would have really been devastating for my system, I think. So it was the right decision to go slow for me. And so I handled that procedure very well. When you get the PICL done, there's 2 times that you're on the table, the procedure table, if you will. The first time is for the bone marrow draw. So you're face down, and you have 2 options. You can get a light sedation, or you can choose to have a local anesthetic numb the area. So you're awake during it, like in a twilight state, but you're numbed in those areas, so you don't feel it. So it's twilight sedation or the local anesthetic. I want to clarify that. And I chose to undergo the sedation. I just decided, we talked about it, my family and I talked about it, my partner and I talked about it, and I just decided that for me it was best to not remember the situation. I just didn't want to be awake during something, and I'm so happy that I chose that route. Everything went really well. So you wake up from the bone marrow sedation, and then you have a few hours to go back to your hotel room or stay in the clinic and relax. And that's just so the bone marrow can be processed. They can take out the mesenchymal stem cells before they re-inject them a few hours later. So fast forward a few hours, and I'm in the clinic, and I'm ready to go into the PICL. So they're going to put in an IV. They're going to, monitor your vitals. They're going to also ask you to rinse out the back of your throat with a mouthwash and a special numbing agent. I believe it's lidocaine in the back of your throat. For those who have very limited range of motion, that was actually quite difficult for me to actually extend my neck upwards to even gargle. Took me a really long time, but the nurses were really patient with me, and I really appreciated that. And so once that happens, you're fitted with a mouth guard, you're laid on your back, and you're put to sleep, and then you wake up from the PICL. So I didn't remember anything. Obviously, I was asleep. But when I was in the recovery room, I woke up, I was laying on my back, and I remember feeling that initial inflammation. And the pain and inflammation for me lasted 2 days. It was a very sore throat, dry sore throat. I didn't take anything for it. I just drank hot soup, so my partner had that ready for me when we were back at the hotel. And yeah, I just sipped on soup for 2 days. And then for the pain, the physicians will write you prescriptions for pain management, and you can use an infrared heating pad, which I used. I did not use the prescription medication. For me, I can tolerate pain.